Lexi, and I am going to be presenting this video about the professional practice model for nursing. The facility that I chose to do this video on is on Valley Health System, which is located in Ridgewood, New Jersey. I'm going to give a little bit of background on this facility. This is an acute hospital. It's located in Ridgewood, New Jersey, as I said before. It's over 1,100 physicians in this hospital, about 3,700 employees, including the RNs, the environmental staff, the care partners or patient care techs, whatever you want to call them, etc. And 3,000 volunteers as well. It's fully accredited. As I said, it's an acute care facility and it's not for profit. It serves more than 440,000 individual people in 32 towns in Bergen County and the surrounding counties in this area. It has about 451 beds in this hospital as well. It has a cardiology unit, oncology unit, orthopedics, neuroscience, women's and children's services, fertility treatments, and many, many more. And it also has a comprehensive cancer program. I also found some statistics that there were about 46,717 people that were admitted in 2016. 73,133 people were treated in the emergency room, and 3,366 new babies were delivered in 2016. Their mission statement is the Valley Hospital serves the community by engaging our patients and families in care while providing healing and comfort and teaching good health. What does that sound like? It sounds like a theory to me, but we'll get to that in a minute. Their values are service, excellence, respect, value, and ethics, which if you do the acronym going sideways of just a capital letter of each word, the first letter, it spells serve, which is a big thing for them. So let's get right into the model, which is pretty straightforward. I did a little research on multiple models, and some were just so basic that they gave me no information. Then there were some that were just so elaborate and so much information. It was overwhelming. It was like, wow, I don't really know what to do. So with that being said, I went with this one because it was straightforward, but it was enough information to make me understand exactly what their goals were. And it wasn't overbearing. And I thought it was very comprehensive at the same time. So with that being said, here at Valley Health System, their professional practice model is based on, and going back to that theory that we spoke of, the one, the only Dr. Gene Watson. They focus on the patient and the family. That's the center of their focus. Everything that they do surrounds the patient and the family. They basically say that it emphasizes that the patient and the family are the center of all that they do because it contributes to the profession of nursing. Each section of the model highlights the essential domains of nursing practices at Valley. Gene Watson, it's the representation of the framework. It guides their nursing as they provide quality care to their patient and their families with the collaboration of the interdisciplinary teams. We're going to go ahead and get right into the domains that they have for this. The first one is the professional recognition and development. This is great. This one is basically their education process when it comes to going forward and developing as nurses and other interdisciplinary members of the team. They are big on highlighting that they have highly qualified nurses that are part of their nursing philosophy is a commitment to professional development through lifelong learning. They're big on learning. So what they do is they believe that it's important to make sure that their nurses are committed to continued education and continued excellence, which is awesome. The next domain would be the professional nursing values. This part is basically making sure that their nurses have the skill set for the acute care setting, as well as know how to do medication management, handle these different chronic diseases, and make ethical decisions. And this comes from their education and their knowledge and their skills. And they have to know that one little acronym that we love so much, ADPI. They need to know that assessment, planning, intervention, and assessment, diagnosing, planning, intervention, and evaluating. They need to know all of those things in order to make sure they have those professional nursing values that they have as the core of their practice at this facility. Next would be shared governance. This part, it provides the guidelines and structures for the processes to be developed, disseminated, and enculturated for all levels of nursing, wherever nursing is practiced in the facility, whether it's decision making and also the accountability for improving quality care, safety, or enhancing the work life. These nurses have direct care of these patients, and so direct care nurses are treated as partners and team members, and they need to understand that their goals are in alignment with accomplishing the mission and goals of nursing and the organization. The next part will be quality. Quality is very important here. As each nurse continues to evolve their profession, the results of open communication and participation in governance activities and pursuing advancement of knowledge and skills lead to continual strengthening of their missions and their values here. So this requires that these nurses be highly skilled, and they have a lot of motivation, and they have a lot of commitment, and that means that this quality is necessary. They need quality nurses, and that's important to their team. Next would be the care delivery. This is where that patient and family center focus of Dr. Jean Watson comes into play. That is the foundation of their nursing care delivery model, which it incorporates the patient and their family members as the true collaborative partners in the care of that patient. So their delivery system and model flows strictly through that. And last but not least, their collaborative practice and relations. They develop solid collaborative partnerships that they foster, which all professional healthcare disciplines can work together to meet the goals of the patient. This includes the nurses, physicians, the leadership of and the ancillary patient care staff, and the entire healthcare system. They all work together, and their structure and process that they are able to continually improve the nursing outcomes and strengthen the interdisciplinary collaborations within the organization. The nurses play a big role in making sure that these hospital operations and the delivery of patient care is met. So, in a nutshell, I think that this professional practice model for nursing is awesome. It includes everything. It includes continued education for the nurses and the rest of the staff. That's a big thing. That's important because these nurses need to know what changes there may be. Like Joint Commission has now made pain as not a part of the initial assessment when it comes to vitals. It's not considered a vital anymore because of the overusage of pain medication. I also believe that this model has included the rest of the healthcare team to make sure that they are considered part of the team. The interdisciplinary team is considered collaborative, and they have a part of making decisions as well. And last but not least, and definitely the most important thing of their model, is the patients and the family are the center focus. Their theory is based around Jean Watson's theory of the family and the patient being the center focus. So I think that this professional practice model for nursing has actually hit a pretty good mark in making sure that it reached all the most important components and delivering what needs to be delivered to make sure this facility is awesome. Thank you so much for watching this video, and I hope you enjoy it. Have a good day.